Hello guys, this is Rahul Lalit Jain and my topic is antidepressant and anti-anxiety drugs. Okay, so these drugs are basically used to treat anxiety and depression. So what depression exactly means? Is it related to our daily life? Is it related to the sadness we faced in our daily life? No, it's not that simple. It is a very broad term. Depression is a very broad term. Depression is not that simple and we need to relieve the social stigma related to the depression. So my question to you is that what exactly depression means? What is depression? Depression, signs of depression. The first sign of depression, anxiety. As I said, anxiety is so dangerous. Hopelessness. We don't find a purpose for the life. We feel hopeless all the time. God has nothing planned good for me. These are the thinkings of the people who are in the depression. Mood swings. Exactly, mood swings. What exactly mood swings means? At a first particular time, I want a coffee. At second particular time, I want a tea. And at third particular time, I want beer. That what exactly happens here. Change in the body weight. There is no regular time for having a meal. There is no regular pattern to have a meal. So the change in the body weight is a very obvious reason. Either the people in the depression become obese and gain the body weight, or either become so skinny and decrease in the body weight. It depends on the particular BMR of that person. Uncontrollable emotions. I am angry. I am sad. I am not feeling well. That's what emotions takes place here. Feeling low. Okay, I am feeling low because I have not done any study today. This feeling low happens with me as well, but it's not that I am in depression. The feeling low, it's a consistent sign which is there in the people who are in depression, and in the people like us, it takes place. The feeling low, that this is a tendency which is only for a particular time span. And after we feel something like playing cricket, our feeling low wali tendency goes on and we feel enthusiastic. This is what happened with us. But this doesn't happen with the people who are in depression, particularly people who are in a typical depression. There are two types of depression, typical depression and atypical depression. In the typical depression, whatever we do, people who are in depression are not going to feel well. And in atypical depression, suppose a lady who is in a depression, she is suffering from a depression, she is depressed from last 2 hours, but suddenly she meet her baby and she start feeling happy. So this is what happened in the atypical depression. Next sign, insomnia, रातों को नींद नहीं आती. And the most dangerous sign, suicidal tendency. God has nothing planned good for me. There is no purpose of my life. No one loves me. This all thought constantly get inculcated in our mind and we feel suicidal tendency. Suicide is the last option for those people, but it's not that like, guys. There are many options available. You can get a motivational therapy. You can get a medical therapy like antidepressant drugs. Which is our topic today. Antidepressant drugs has a lag period, like 2 to 3 weeks is the lag period of the depressant drug. Like if I will consume those drugs today, I will get its effect after the 2 or 3 weeks. So most important thing, guys, not every disease is the fever. Like we will take a medicine, after 2-3 hours our fever will reduce. It's not like that. Certain disease or certain disorders like depression, OCD requires a time, and the time lag of the antidepressant drugs is like around 2 to 3 weeks. So we need to think about that and not to stop our treatment. Okay. Okay, let's start about our main topic. I have given you the basic outline of what depression exactly means. So depression scientific term, in scientific basis of depression, I forgot to tell you that scientific basis of depression, like neuroinflammation, neurotransmitter imbalance. The main neurotransmitter which causes the depression is serotonin. Along with that, norepinephrine, dopamine, that are few neurotransmitter. Synapse dysfunction, impairment of neurogenesis. Okay, so let me classify our antidepressant drugs. Antidepressant drugs, the drugs I am going to teach you further in my PPT are MAO inhibitors, which are moclobemide and iprobemide, and TCA, like tricyclic antidepressant, which are amitriptyline, doxepine, clomipramine, and desipramine. These are few antidepressant which I am going to cover in the next slides. So focus on those slides. Okay. So shall we continue? Okay, other antidepressant are selective serotonin reuptake inhibitors, SSRI, atypical antidepressant, and serotonin and noradrenaline reuptake inhibitors. These are going to cover in the other PPTs. So we will focus on the MAO inhibitors and TCA, tricyclic inhibitors, in this PPT. Okay. Monoamine oxidase inhibitor, that means MAO inhibitors. What does it exactly functions? Its exact function is like that monoamine oxidase, which is an enzyme that decreases the neurotransmitter which are serotonin and norepinephrine. So basically what our aim is to decrease this MAO, monoamine oxidase. So we will use the drugs which decreases the MAO, and those drugs are called as a monoamine oxidase inhibitor. These are of two types, selective and non-selective. Selective drugs consist of moclobemide and iprobemide, and non-selective consist of phenelzine and isocarboxazide. Okay. So this drug decreases the monoamine oxidase. In turn, there is an increase in the neurotransmitters like serotonin and norepinephrine, and which in turn decreases the depression. These drugs are used for the treatment of atypical depression. I already told you what atypical depression means. Okay. So this is second line drug. There are certain side effects. Yes, there are certain side effects. Side effects are hepatotoxicity. It is toxic to liver. Cheese reaction, serotonin syndrome, and severe muscle rigidity. Your muscles will become very rigid. And what is the treatment for it? Benzodiazepines are used. Okay. So non-selective inhibitors like phenelzine and isocarboxazide, they are also called as hit and run drugs. So keep this in mind. Okay, now we will proceed to tricyclic antidepressant. Tricyclic antidepressant, what is our aim? We need to inhibit the reuptake of serotonin and norepinephrine, and the mechanism of action of the tricyclic antidepressant is the same. It inhibits the reuptake of the serotonin and norepinephrine. As you can see in the diagram, tricyclic imipramine is inhibiting the reuptake of neurotransmitters like norepinephrine and serotonin. So what are the names of this class, drugs belonging to this class? Desipramine, clomipramine, amitriptyline, doxepin, nortriptyline. These are few drugs related to this class. As I already mentioned, the mechanism of action is reducing the reuptake of norepinephrine and serotonin. So few drugs are potent to inhibit the reuptake of serotonin, while other drugs are more potent to inhibit the reuptake of the norepinephrine. So desipramine, which is the drug having the more potency for inhibition of the reuptake of the norepinephrine. So okay, elimination of the TCA. Okay, let me move my face from here. Elimination, hepatic oxidation and TCA are metabolized in the liver by demethylation. So how the TCA are eliminated? By hepatic oxidation. You need to remember this as it is asked many times in the MCQ exams. So let me proceed. Okay, so हर ड्रग के कोई ना कोई साइड इफेक्ट्स रहते हैं. So what are the side effects of TCA? You can memorize this or you can remember this as a mnemonic. I am going to tell you, which is ACSD. A means anticholinergic side effect, C means cardiovascular side effects, S means seizures, and D means death. Yes, the side effects of the TCA is death if it is taken in the excess of amount. What are the anticholinergic side effects? Sedation, delirium, coma, tachycardia, mydriasis, dry mucous membrane and skin, and dry mouth. Okay, so let me tell you that along with those side effects, TCA also blocks H1 receptor, alpha receptor, 5-HT2 receptors. So we need to face the side effects which are related to these receptors. I mean blocking of these receptors. which are like if we block the alpha receptor, we need to face the postural hypertension side effect. If we block H1 receptor, we need to face the obesity wala side effect, and these are like a few side effects. And as I said, death occurs in the toxicity or the side effect of the TCA. The death mostly occurs because of the arrhythmia. Yes, you need to memorize this as well, as these are asked many times into the MCQ exam. Okay, so now TCA is toxic. I mean, TCA toxicity took place in our body. How will you solve this problem? This is the most important MCQ which are asked multiple times in our examination. The treatment for TCA toxicity is the sodium bicarbonate. Highlight this point with 2 to 3 stars. So now we have completed the side effects of TCA, and now it's time to use our brain. I mean, we need to solve few MCQ. Use your brain. Actually, there is no need to use your brain, because I am gonna tell you some answers and mechanism behind. So MCQ, use your brain. Actually, there is no need to use your brain, as I am going to tell you the answers of the MCQ. So first MCQ, which drug causes the serotonin syndrome? Yes, I have recently told you in the previous slides. Options are SSRI, SNRI, TCA or MAO inhibitors. What is the answer? Yes, answer is fourth, MAO inhibitors. Question number 2, which is the most lethal on overdosing? Like this MCQ is not covered in the previous slides of theory, but I have added this MCQ here, so we will come to know what is the one of the side effect of overdosing. So can you guess answer? Yes, it's first desipramine. Next, which is the selective MAO inhibitor? Okay, this is covered in our PPT. Phenylzine, isocarboxazide, doxapine or iprovamide? Yes, it's very obvious, it's iprovamide. So question number 4, what is the treatment of cheese reaction? This is confusing. I am asking you the treatment of cheese reaction. What we have seen, the treatment of side effect, which was benzodiazepines. But here, what is the treatment of the cheese reaction? The answer is phentolamine. One more new point added to your theory, which is a treatment of cheese reaction. It is a phentolamine. So let me move my face from here first, so you could see the question. Next question. So in the previous slide, I told you to 5-star one question, which is a drug of choice for TCA toxicity. I have told you that it has been asked in the various time in the previous MCQ exams. Drug of choice for TCA toxicity: potassium, sodium bicarbonate, or none of the above. Yes, it's very obvious, sodium bicarbonate, as we have covered. So this is what we have to cover here, and thank you so much for the patience listening.